Hello, and congratulations on choosing our Home Operational Practice Equipment, or HOPE, package. What you can see in front of you are some of the attachments that you may or may not have received. We'll very quickly go through each of the components. You may have different components within your pack. It will depend entirely on what exercises we are intending to carry out. The purpose of this equipment is to be modular and allow for a number of simulated clinical exercises, or alternatively exercises that may instill clinical skills within the user. The first and universal component that you will receive in the pack is this. This is the base model that all our attachments can fit into. This will go on a flat surface and simulate the 90-degree maxillary plane to the floor that is often employed when working on patients. The canted side is the mandibular component, and this should be affixed to your table. To do this and stabilize the device, we provide you with some plastic adhesive reusable material, which you can use to fix this to your tabletop. The particular attachments for different exercises vary, but we can see a variety of them over here. These plates are universal mounting plates and will allow you to place simulated jaws within your model. To do this, there is a gutter on the underside, and you can use an M6 bolt or screw to affix it. These will be compatible with most models. And then these just go with a half rotation into the device. To remove it, just rotate it, and to take it out, just do that. You may notice these models have orthodontic brackets already fixed on them. This is for a particular exercise, but the models you get may be different. They could simulate periodontal issues or be a generic set of simulated teeth. You can have some specialized attachments as well. An example of these would be these 3D printed malocclusion models. Similar way, make sure you know where the mandible is, and then you circular, lock it in, or take it out. Sometimes there can be significant friction generated by these models, and if that's the case, just smoothing the edges of them with a bit of sandpaper may help you. There are some specific exercises, and these are less similar to the clinical environment, but will instill some skills within you. These particular models are designed to allow us to mount different drawing exercises. An example of these can be seen on this sheet. We have occlusal designs, and we have lingual and palatal designs. You cut these out, and then using some of our adhesive plastic material, stick them onto the model. The goal of this exercise is to color in the white spaces within the red shapes without touching any of the red. And to do this, we use a very specialized pen which simulates a handpiece. The purpose of this is to instill indirect vision skills and ergonomics of how to correctly hold a handpiece, how to use finger rests, and how to maneuver an instrument in a similar way to how you would do it on a patient. On a patient, the actual clinical aspect of this will be determined by the clinical situation, but for this particular exercise, we will employ a number of the principles that you would employ. To go with this, you've been provided with a disposable mirror and also a disposable probe. An example of this setup looks like this. And you can see the different exercises and how they increase in difficulty as you get nearer the distal portions, similar to working with a patient. The purpose of these exercises are to develop your skills. Do not be disheartened if you find you either don't completely fill in the spaces or if you do hit the red outlines. This exercise is actually very challenging for clinicians of any level of experience. The final two attachments we'll look at here are simulations of dental arches where you will see there are teeth missing. Within these square holes, it is expected that you will place some modeling clay that has been provided for you within this pack. And using some simple carving instruments, what we would ask you to do is replicate the missing teeth and complete the arches. Now, there are a number of different ways you can look at this. You could try to mimic the tooth from the contralateral side of the arch, or you could go by ideal anatomy. There will be an element of artistic license in this, and when you're doing these exercises, consider occlusal planes, consider arch forms, and consider what you feel would be the aesthetic best outcome, along with the best functional outcome. I really do hope you enjoy this and find this to be an engaging and stimulating activity. If there are additional attachments that you would like, please feel free to contact me. We also have other exercises that are not included within this pack.